Welcome to episode 92 of the Lebanese Physicians Podcast. And today we will continue our podcast episodes on medical donations after our last episode, which was episode 91. And today we'll be talking about med donations. And our guest is Marina Al-Khawand, who's actually a law school graduate from Sagesse University. But she will tell us how she got into med donations and how she is into biology and diseases at this point. So welcome, Marina, to the podcast.
Thank you, Khalil. It's a pleasure to be on your podcast and to really discuss the mission of med donations and everything in between.
Yeah, so basically, I saw that you're a law school graduate and then you started med donations afterwards. So what's been happening? Let's start first with like what's been happening in Lebanon in terms of medical supplies and how they've been affected over the past 4 or 5 years at this point.
Yeah, sure. So I was at the age of 18 when the explosion happened. And at the same time, I had finished my first year at law. So, and law school in Lebanon is for 4 years. So I had this mission when I was a young, a young girl that I want to defend the human rights and save lives. First, I wanted to be a surgeon. Then I didn't end up in law school, in med school because of mathematics. So I shifted into law school because I'm a big defender of human rights, and I thought that I would be able to drive the change from the court, and by changing some laws, I thought it was that easy. You know, that innocent small girl's mind. Up until the explosion happened, and on August 4th, 2020, my entire life has changed, as shifted 180 degrees. I had the option, it's either to fight or fly, to fight for my homeland, my country, whatever I had, and I still have as values and as a vision for Lebanon, the country that I want to stay in, grow in, and succeed in, and not to fly away and build a secure, safe, career. Where you'll definitely find many opportunities outside your country in terms of Lebanon now, but I wanted to stay here. So it was kind of, I wouldn't say a motivation to stay, but it was a sign for me to stay and to try to lead the change in a way. And if I fail, at least I'll say that I tried, you know? But if I don't try, then I don't have the right to nag, or even I don't have the right to accuse the politicians for not doing anything. It's every person's job to try to do something out. And just stepping the step forward to try to really create a term of changing one of the negative things that you see, one of the wrong things that you see happening. So just initiating and taking the step forward into action. And this is what exactly I did. I was part of the Scouts movement inside Lebanon, and we were all invited to actually go down the streets and help with the ash removal, distributing some food boxes, some cooked meals, help with first aid, services, and so on. And I directly responded. I wanted to go down and see what's happening and try to give hand to our fellow Lebanese. And the moment where I was down, Khalil, it was as if I am in a nightmare. I couldn't believe what I'm saying. I was walking between dead bodies, between ruins everywhere. Everything was destroyed. And knowing that this is your capital and it could be you at any moment. And what if I was down at that specific hour or second? I would be at the place of anyone who got injured or who died eventually. And it wasn't okay for me that in 2020 we're still seeing war scenes, and we're still living what we've learned in history and what our parents do tell us about wars inside Lebanon, even outside Lebanon. Where is safety? Where is security? No one is held accountable. And up until now, justice didn't prevail, so we don't know who did it and what happened eventually. And this makes us live in a traumatized and unsecure and unsafe environment, because you don't know if tomorrow the same thing gonna happen or the next second. So when I saw all these, and everything made sense for me. People screaming and shouting, and people who lost their kids, kids who lost their parents, they lost everything. There's nothing anymore. even hope, because they had enough from everything. And it was like, the last drop, and the cup is overfilled. Many left the country, many evacuated, many relocated, and up until now they never go back to Beirut. So it was hard moments up until the seventh day after the explosion. There's the Karantina area, Jemaize, Manmkhail, Ashrafiyya, Jatawi, all these areas. But Karantina area was one of the most alarming areas, and up until now it's still, because I would say minority is Lebanese down, and there is a big majority of refugees living there. So, and even the security is not 100% available thing inside this area, and it was one of the most affected because it's the nearest port of the explosion. So, when I stepped into Karantina area, and here I went alone because my team colleagues didn't accept to go with me because of all the things that we were hearing eventually. When I stepped into Karantina, it was unmatchable. The scenes were unmatchable to what I've seen in Marokhail, Jamaiz, and everything. What I've seen there was more tough, and was even more traumatizing, I would say. Only two buildings were still at their place, but at any moment they could collapse. I've seen blood everywhere. I could smell up until the seventh day after the explosion. I can still smell as if the explosion happened now. I can still see leftovers of dead bodies, and even part of bodies. It was so harsh and so tough. And now whenever I talk about it, I can recall the scenes in my head, and imagine someone at the age of 18 seeing this. What will this reflect on the individual himself? I was still walking up until I saw three ladies sitting on chairs in front of their homes. They're not homes for them. They're just ruins on the ground, but they were not accepting to leave even. They were telling me that this is why this point was my room, this was my kitchen, and all what I could have seen, and all the things that I was seeing is just ruins on the ground, and not imagining that this was a home. They told me that you should go and visit a lady that is still living inside one of the buildings that was kind of tagged that this could collapse at any time. I was like, how is an old lady still living there? Is she still alive? No one gave her support. No one visited her. No one relocated her. So the answer was no, and she is not accepting even to go outside her region, to go outside her home. So I initiated to go inside this building. I took one of the architect's hats, and in case anything dropped, I the and the moment where I had to step in her doorsteps, Khalil, I had two thoughts in mind. What if I enter and I find her as that body? What should I do? And what if I enter and she is in dire need of help and support, and I could be her source of hope? So, in between these two thoughts, at that moment, of course, it's not me who took this, who actually took the decision to enter. I was pushed by God's spirit and power, because if I was Marina back then, I wouldn't enter. I wouldn't, and it was so hard on me to eventually think that I'm gonna see someone who is dead, and I'll be alone in this, It was so hard to decide whether to do one of the two. I've entered, and thank God I've entered. Because the moment when I entered, I saw a lady in her 70s laying down her chair. Her color was pale. And I didn't know anything about health and what the colors do reflect and everything. She was trying to take a breath, and she was holding a ripped box of paper. And this ripped box was a box of medication. So seeing her in this condition and seeing her holding a rip box of medication, and this medication is a medication that resembles to me since my mother is an asthma patient. And I've seen this medication before. So I directly knew that this was the same medication my mom's take. It is an inhaler for asthma patients. And seeing her in this condition, I knew that she needs her medication. She's not being able to breathe correctly. So her oxygen levels are dropping. And I know the condition of an asthma patient not taking this medication. So I rushed back home. I asked mom over this medication and the conditions. What if the patient doesn't take it? And I took everything that information that I need, and I rushed back to the pharmacy. And suddenly I know that this dose is not available. So it was kind of two situations happening in front of me. First, lack of medical support during the explosion. And whenever I say lack of medical support, it's not first aid support. It's chronic medication support directly, because we live in a country where we have a high percentage, I would say more than 50% of our population takes chronic medications. And we live in a country which most of the population is sick population. And these numbers are increasing, and even increasing in young ages. And what if we're talking about the region of Beirut? If we talk about a little bit of demographics, most of the individuals living down are elderly and are people above 40. So they most probably have heart problems, hypertension, diabetes, asthma, and so on. And the cloud that evacuated from the explosion, what eventually got exploded, is ammonium nitrate. So people who doesn't have pulmonary issues and diseases face problems. So what if an individual who already have? What will the conditions be, and what will the state of this individual be? So all this was aligned, and whenever I reached the pharmacy, and it was the first reply was this dosage is out of stock. I was like, what? And how the individual will be able to secure this medication? Why the medication is out of stock? And even if it's in stock, it's so expensive. So I didn't have the knowledge before to ask my parents what do they take, how do they secure their medication, if there's insurance, how much do they pay, and everything. But the moment where this happened to me, I did. So I posted over Instagram the story briefly, and after 2 hours, a Lebanese economist shared the story, and her friend that eventually lives in Australia, she owns a pharmacy inside Lebanon. She decided to actually donate the full stock of this medication. So in 2 hours, we've been able to secure 12 boxes of this medication to this lady. I took the medications, got back to this lady's home, and I had the same two thoughts, Khalil, when I stepped her doorsteps. What if I enter and now I know her? I visualize the patient, so I know her image. I have something in mind. I know her condition, and it's gonna be even more tougher if I enter and I see her, as a dead body, and I couldn't make it on time, because when we talk about health, we're fighting with time,
Right.
and the heartbeats cannot wait. The individual's health cannot wait. The individual's breath cannot wait. So we're literally fighting with the clock and time. So I entered, and thank God I made it on time. So this was the first concern for me, to make it on time for her. The moment where I took the first box from the bag of 12 medications with me, she started tearing up and she started crying. Imagine just now seeing an old lady sitting on a chair with no physical activity in her 70s, crying because she saw her basic right, her medication box. That is the basic of the basic of the basic right a human being should have. So it was the happiest at the same moment, the saddest moment in my entire life, because it's a mixed feeling that I'm happy that I was able to secure it, but at the same moment I'm so sad that we live in a country where individuals are just numbers. And it's not only in Lebanon. In most of the countries now, unfortunately, we're seeing less humanity and less focus from the government to have a structured and a targeted crisis modes and war conflicts plans that will target the need of the individual, not just random donations. And before I leave her home, she hugged me. And it was the most humanitarian, human touched hug an individual could have. And she tells me one sentence that started the whole story of my donations, which is, "Thank you for saving my life."
Right.
Before 2 hours, I was just a normal human being, a law student, as you said, as you mentioned. And after 2 hours, I'm now a lifesaver. So that moment resonates a lot to me. It was the start of every single thing about my donations.
Yeah, I mean, you you did the work that should have been done probably by the government
Most probably.
or by other ministries and in the country, and that was not done at the time. I mean, just to remind people, at the time of the explosion, it had been a couple of years since the economic crisis started, and medications were at that point in short supply for various reasons, actually.
Yeah.
And this accentuated, I think, the supply issues of the medications. Uh, So yeah, so the explosion happened. This is a great story that led you to start med donations. So basically, you started med donations while you were still in law school at Sages, right?
Yeah,
That was
right.
a lot of work.
A lot of work.
So did you have any free time?
No, definitely not.
So how did you start it? I mean, we hear a lot of stories. All of us like hear stories of patients not getting their medications or people shipping or bringing supplies from outside. But you did something about it, which a lot of people have not done. So how did you start it, and who did you talk to like after this event that happened?
Okay, so basically the second day, okay, so this event happened on 10 August. The second day, on 11 August, I was down the streets holding a notebook from being a total innocent and with zero, I would say minus thousands knowledge in medications and in health. I was just knocking on doors of individuals living down and asking them about their medications. And the first reaction was, why are you asking us about our medications? Will you help us? You're no one. You're not an NGO. You seem to be very young. And I'm even so innocent that I wrote the medications wrong. And I still have them on my platform up until now because I want to keep, this humble stage of not knowing anything, but from nothing, we did something. So I wrote aspirin wrong, the dosage is wrong. It was just, posting these as Excel sheets and doctors calling me, Marina, you should pay attention. This is wrong. The dosage is this. Pharmacists calling me, people that I don't know. I knew no one, Khalid. Individuals were calling after one day of posting the Excel sheet on Instagram. With a day, we're securing 20 families. So imagine more than 70 medications per day. We're directly being secured from individuals all over Lebanon calling. We need to drop off the medication. We meet them on the highway. And also with my friends, we were just a group of friends trying to do this and to pursue with the mission. And we said if we were able to save 10 more lives, then we did our duty and khalas, it's over. But from one life, we got addicted. And personally, I got addicted to saving lives and to the humanitarian work. When I say humanitarian work, I'm not a pro nonprofit individual. I do not really like the nonprofit world, especially in Lebanon. It's so much corruption,
Right.
so much in between things. So in a way, I wanted to revolt on the system because I've seen what I've seen on the field, and I know what do they do. And at the moment where I was exposed more to patients, I was listening to stories that were scary stories. How do they promise people to go and help them, and how they end up faking the promises, and how do they take data and sell the data, and how do they profit from misery and tough conditions of these individuals, and they just fill up their pockets with money. It was I wanted to do something out of this. If I want to truly defend human rights, it's between doing action on the field, and I want to do the action on the field. It's not donating to someone and this someone doing the action, because I have zero faith in anyone. And for me, back then, and up until now a bit, I would say, I cannot trust anyone doing any action except me doing it myself on the field and making sure that this medication is being received for free, by the individual who is in need of it, with no charges, with nothing else, because this is a basic right of the individual. So after August, September, October, November, December. We've reached December where COVID started hitting and COVID cases were even increasing more. We started hearing that eventually individuals are dying inside their homes, in front of parking lots of the hospitals, in front of hospitals even, and inside hospitals due to lack of oxygen and proper care for these individuals. So I launched the first fundraising campaign of med donations to gather monetary donations to buy these oxygen machines. We bought seven. I took the training needed to go to these patients' home and place the machines inside their home. So we were able to save lives even with oxygen, because our main goal is that no one should die because of lack of medical assistance and lack of medications. So I was like, if I wasn't able to continue with this mission during COVID, it's better that I stop, or I should do something. So not a barrier could stop us, not a disease, not an illness, not a virus, nothing, not even a pandemic could stop the mission from going on, because patients' lives are linked to our mission. We proceeded with COVID-19. It was, thank God, a successful campaign up until we reached we reached June 2021, where the total shortage of medications happened inside Lebanon. So we couldn't find Panadol in our pharmacies, which is Paranol in your case. We couldn't find ibuprofen. So from the basic over-the-counter medications that doesn't need prescription to the most chronic medication, we're all out of stock, and even maybe formula. So my supply was from Lebanon. All donations were from Lebanon. How would I proceed now with the mission? Patients are dying, no medications, total shortage, and my mission is to secure medications to the patients. What should I do? I
Yeah,
had
what did you
zero
do?
clue. Yeah, so here's the thing. On August 4th, 2021, so after 1 year of the explosion, a friend, she's a Lebanese pharmacist living in Boston, she calls me and she tells me, Marina, we should do something. Okay, it's after 1 year of the explosion, but we shouldn't cry over something that happened and only cry and just remember these tough moments and this tragedy that happened. People are still dying now, not because of the explosion, because of lack of medications. So we should do something out. And what we did is that we launched a collection point inside Boston, a collection point where individuals from all over, Lebanese, not Lebanese, drop off medications inside one location. And then whenever these medications are collected, we need to send them back to Lebanon. How? We didn't have a clue. What we did is we directly launched the flyer on social media platforms. The second day, they collected 60 kilos of medications. Imagine, from having zero boxes inside Lebanon, I get a call from the US that, Marina, we have 60 kilos ready for you. I was like, what? All over this year, I couldn't collect 60 kilos of medications. It was the happiest call for me at first. But now, how should we send them to Lebanon? This was the big question mark.
Right, that's a big
So we
question.
started by passengers. People traveling to Lebanon, they carry with them some medications and they reach Lebanon. We directly take the medications, sort them, distribute. And imagine, Khalil, the ripple effect that from one flyer that you posted on August 5, we had 3 new collection points in 3 countries. I didn't call anyone. Individuals were calling us wanting to do the same in their own countries. And what is even more positive about it, it's not Lebanese calling only. It's foreigners, individuals living all over, calling to make donations and to do drives inside their countries. So we reached October, where we actually received a ton of donations from Qatar. So the amounts were really increasing a lot, and the demand is increasing a lot. And by that moment, we opened our operations from a closed operation that is based on field to field assessment to an all over operation over all Lebanon. So basically, before August 2021, we were only an operation based on whatever we see on field and the families that we visit. And afterwards, we opened our operation to anyone inside Lebanon that is not being able to find access and get their medication, whatever was your status, because we were equal in this. And after August, we reached 2022. After this frame of work, we've launched in 30 countries the donation drive. So imagine individuals living in 30 countries, collecting, sending, and doing the same whole process. Mid 2022, the crisis started decreasing a bit in a way that central bank inside Lebanon started issuing money for the pharma companies to import medications. So the short of medications started getting less. So people now can access better the medications if they have the financial ability. So now it's back to the severe assessment, which I need to know if this patient is in need, yes or not. If they are in need, if we have the medication, we give it for free. If they're not in need, we direct them to proper resources where they can actually find the medication. So proceeding with this, 2022, 2023, we still launched the international medical drives, and up until now, 2024, all over these 4 years, we have launched collection points in 65 countries,
Wow.
covering all continents. Yes, 65 countries. So, and my aim is to reach even half of the world countries, because it's a mission that unites humanity. And it's not only in Lebanon. What's Med Donations created inside Lebanon is a system that could be replicated in any country facing the same issue. And I'm happy to even say that we've seen this replicated in Greece with GiveMed. Now it's being replicated in Switzerland with ShareMed Swiss, and many countries, and even Morocco. We have a small group that is doing the same work of med donations. So this is the mission, to inspire individuals to start impacting their own communities from just collecting medications. And the community is not in use anymore. So it's not only buying medications, it's also having the awareness that this medication that your government gave it to you, if you're not inside Lebanon, and you stopped it or you don't need it anymore, this could save a life of an individual in another country facing financial maybe circumstances.
Right, right. Because a lot of times you either throw these medications away or you distribute them to people in your own country, but you don't think about other countries that are
Right.
that could be needing this medication, especially like countries where there's economic crises. I'm going to point something important to your story is you basically did not give up. You instead of giving up and saying things are not getting better and I have no hope, you actually created hope from a dire situation where there was no hope. So one thing I was going to ask you, so basically you're doing all these donations and most of the shipments of medications to Lebanon are coming through travelers to the country, right? Not like through shipping companies or anything like that, right?
We had actually three
Okay,
shippings to Lebanon, but the process is so hard.
right,
So basically, whenever you ship, you need the shipments will take a lot of time, in between 6 months to eventually 9 months to be cleared inside the customs and everything. So eventually, I go back to the point that the patient's life doesn't wait. Whenever we're talking about chronic medications and chronic conditions, we need to directly secure the medication for the individual. Otherwise, the patient will lose it. So whenever we have big quantities as bulks, we get them with shipments. But whenever we need eventually to get the medication directly, we get them by passengers, and of course by following the rules of every single country, airports and customs and in all countries. So, and even we have now a checklist that the individuals could check the medications before sending them to make sure that the medication is okay, can be sent to avoid any troubles and any conditions that could be harmful. So, but we have both options. Of course, the first one is more costly in between shipments because you need financial funds, and my donation is not based on financial donations.
it's meant
Uh,
donation, right,
yeah, exactly. My donations is not eventually based on financial donations, so we don't take monetary by the first stand. We take in kind donations as medications directly from doctors, clinics, pharmacists, individuals, whoever wants to donate. So that's why the operation of logistic wise, I would say it's harder because now eventually whenever the situation gets better inside Lebanon, the airport regulations get tougher. So whenever there's a crisis, the regulations are less tough. Whenever there's not a crisis, the regulations are more tough. To avoid also drug smuggling and everything, which we all know that medications and this topic eventually are there's a thin line between them.
right.
So of course we're following all the regulations needed to be able to make it very secure.
Right. And so my next question with you is, I mean, it's a big operation. So how many people do you work with inside Lebanon, and I guess how many people outside Lebanon right now do you work with?
Oh, very good question. So basically, inside Lebanon, the team of Plant Donations, the board team of Plant Donations is basically made up of six. I'm most of the time it's a solo work because the board is basically full-time employees and other companies, and I'm also an employee of my own company, which I have a startup alone. So we need to work to finance Med donations. I'm eventually 24/24 inside Med donations to be able to make the operations happen. We have volunteers coming every now and then between university students, med students that have specific hours to volunteer in. So, and also we have volunteers that comes from outside Lebanon. We also have volunteers an age group of 50 plus that are basically some of them retired and wants to donate their time in some social work. So I would say all in all, it's in between 20-25 individuals, but not on monthly basis. So it's a tough operation to operate with a small team inside Lebanon. Outside Lebanon, the amount is very big because talking about 65 drives in 65 countries, it's not only one drive in the country. So if I would say the states, it's more than 25 drives over the states that we have. So, and even in France, we have more than 15 drives. So, and these drives are led by more than one individual. And this individual is getting donations from more than 10, 20 individuals. So, if I would add up the number of all the supporters of med donations from outside Lebanon, we would reach more than 2,000 individuals. So this support that we're getting from the external side and international side is the backbone of med donations. And it's always a human-centric organization, I would say, and this is to highlight on that we do not work with organization. We only work with individuals. We only have 3 organizations on board that we actually collaborate from now and then with them. But we want to keep it an individual effort, because whenever you do the job yourself, example, if you now start a collection point Khalil in your state and collect medications and send medications, you will directly feel involved directly inside the mission, and you will feel the impact. It's more than that you're donating to a nonprofit, and this nonprofit is donating to a nonprofit inside other country. So you are involved in the operation system in a way that you can feel the impact. And even I would say half of these volunteers, international volunteers, were with us on field one day. So they lived the experience of saving lives directly, and they've seen one of the patients that they were supporting and more. So this is the one of the highlight values, I would say, in my donations, to keep it that humble, that simple, to keep it with individual efforts, because the impact that we want to make is with individuals, and eventually the change that we aim to lead is with individuals.
Right, and I think when you do it just medication donations without like monetary donations, I think it makes it also more people will feel more empowered to help and maybe more trusting of the organization, because a lot of NGOs in Lebanon have used money for other reasons.
Absolutely right.
So because I mean it's a big operation, like you need to like screen the families who need help, and then you need to distribute the medications that arrive and make sure that these medications are not expired, let's say, and all the stuff. So it needs a lot of work.
Sure.
Does some of the screening happen before the medications get shipped, potentially?
Absolutely.
Yeah, yeah.
Sure. So the screening now, after after and I would repeat again, after 4 years, we have the assessment done by most of the families that we've helped. But what really made our operation more tough is the 2 years of shortage, because we couldn't screen the families.
Right.
So our operation was open operation, and it's very hard to be able to have a team on field to screen all the families. We've helped 20,000 individuals, and I would need a year to be able to assess these 20,000, and even more than a year if I had a team of 50 individuals going every single day to all regions inside Lebanon to assess. So it's a tough way to proceed. So now what we're doing eventually, the patients that are still on board of med donations, we're assessing them. And this assessment means that, okay, we assess the case, but it's not for sure that we're going to get the medication, because we send the list of medications that we need, but whatever is collected and sent. So it's not that absolutely sure we're going to secure this patient every single month, or eventually we're going to secure this medication every single month. Whatever is collected and sent is secured to the patient. So by this, it gives us a two-side operation. One side operation is that the elderly and individuals that doesn't have any type of support, no individuals outside Lebanon living, no support from eventually other organizations, we try and do our best to secure them on monthly basis, on monthly basis with all their medications. The second group is that individuals who have individuals inside their families that work with minimum wage, so they cannot afford the full prescription. We help them with whatever we can help by medications. So here's the assessment part that plays the role. And even whenever we have a treatment or surgery, because here's the monetary thing that really have as a spec, I would say. If there's someone that is in need of a chemotherapy, I would say, or as an urgent heart surgery, we severely and strictly assess the case, because we want to make sure that if this individual living outside Lebanon donates 1 penny, that this penny is used for the right individual. And here we only make a social media campaign of the example, 1 week, we did a surgery for a lady after the explosion and it costed $7,000. We did a 1.5 week campaign over Instagram. Whenever we collected the amount, we stopped the campaign. We directly paid ourselves the hospital, we got a receipt, and we sent back to the donors. And it was just this. So whenever we have a severe case that is in need of a treatment or a direct surgery, and this individual is not being able to secure the amount, or no one is helping them, we interfere in a way by using our connections and our individuals that eventually are on board and always offering the support to help them have their surgery or treatment done. And we've helped more than 110 individuals have their surgeries done and treatments done. So this is for the monetary side. For the assessment, again, now we're following a CRM software. We have a CRM software which all the data is implemented into technology, and eventually in the future, hopefully year, we will have a platform, an application platform which will have all the data, and the individual will be the ownership of their own data. So by this, the individual only assessed will be able to access this platform, which will be high tech platform. They will have telemedicine, AI plugins that will help them in many things inside their health journey. So by this, only individuals who are assessed will get it for free, and individuals who are not who eventually are not assessed or are assessed but not under the monthly basis, individuals will not be able to eventually get access for it for free. So it depends on the individual case and on the also country's conditions. So eventually, if tomorrow, I hope not, uh any medication will get out of stock and we get a request for it, we will give everyone this medication. It's a matter of supply, if this is available or not. And our mission is to help everyone. So I'm not someone who will work by tagging individuals by their financial status and everything. It's a mission beyond poverty, I would say. It's a mission of accessing your rights.
Yes, it's basically access to medications and access to healthcare,
Absolutely.
partially related to supply and demand, and partially related to poverty, if the supply
Absolutely.
is
That's it.
there, right? And finally, how many individuals are you helping at this point? You, I think, mentioned the number earlier, but I just want to make sure.
Yeah, 20,000.
20,000 people. And that number, is it, do you think it's going up or going down with the situation currently?
Definitely going up.
Going up.
Definitely going up.
Yeah.
We receive new requests every single day
Yeah.
because clearly whenever someone's come, he will eventually tell 10 more people about that we gave him the medications for free. And I emphasize on free because no one is giving for free. So the fact that someone is still giving for free and we're not getting medications from anywhere. I will not go deeper in this, but we're getting medications from Europe, from the States, FDA approved medications. We know what is the source. We're not getting the cheap medications inside the market. We're not getting, I don't know, medications from the neighbor,
Yeah.
the neighbors. So we're treating individuals as if, and this is a highlight for me. I want the patient to feel like they are family to us, and this is the relation that we've built. I'm treating them as if I'm treating my own family and parents. I don't accept to give them any medication. Same thing, I don't accept the patient to be treated less than if they were part of our families. So this is the high thing that they never get treated the same way inside Lebanon.
Right.
And this is very hard and very tough to accept. They get treated as if people are begging for help and donations. Why? Because they had maybe harder circumstances than we had. And this is not rightful. Even if you're a nonprofit, you're getting donations to give it equally and fairly and freely to these individuals, not even to take one Lebanese lira.
Right.
So
Right.
so
Because
this
one thing
makes you
people don't
angry,
know is, like, let's say NGOs in the US, like, you know what their, you can Google it and find what their administrative overhead is. And in Lebanon, a lot of the NGOs, you don't know what the administrative overhead is. So if it,
Right.
for example, you would donate to an NGO where, let's say, it's 5 to 10%, but if it's the NGO is taking 50%, then you're going to say, why should I donate to that NGO? But you don't know these numbers in Lebanon and what's going on. And
Right.
one thing I think for people to know, just to add to what you're saying, is, let's say if you're in Europe or the US, you pay into Medicare or Social Security and you get back a lot of this free medical care when you're retired. While in Lebanon, people paid into the Social Security fund, but the Social Security fund basically is not present. I mean, it is present, but it doesn't give you any money basically. So
Right.
basically, people do not have any social net, and they need these donations.
Absolutely.
So Marina, what do you think? I mean, what do you think is the outlook in Lebanon the next number of years in terms, because I think there's a limit to how much you can expand too. I mean, you cannot be the government itself. So
Definitely.
do you think things will start getting better at some point? I mean, this is the hard question for you to answer, but but how do you feel things are heading at this point?
You know, uh, in Lebanon now, at the current moment, we're fighting for safety and security.
Right.
The question of healthcare, accessing this, accessing medications, and so on. It's not even a question for individuals, unfortunately. It's a question whether we will have war or not, we will live or not. If I want to expand more in the future, if the situation and the laws and the ministries and the government and even individuals and nonprofits will continue at the same process, we will face much more deeper failures. And no one will be able, not met donations, and no one will be able to operate anymore. Now we're seeing many dispensaries closed. So medical dispensaries that used to be for 10, 15 years in Lebanon, they are closing doors and shutting doors because of lack of donations. So this is alarming and no one is talking about it. These individuals that were benefiting from these primary healthcare centers or dispensaries, I would say, or nonprofits, now what will they do? They will eventually go to other nonprofits. And I'm not sure what is the capacity of these nonprofits. For my donations, we have no capacity. We've reached our limit, but we're still accepting a new request because I cannot just say no for a patient who is in need of medication, but I'm not able to secure more. We are using more than our thousands over 10 over 100 efforts. Uh, what should be done to eventually solve this problem is first to do a medical ID, which the ministry started doing by Meditrack for cancer patients. I urge the ministry to continue doing this because by this you're regulating the market. You know, every individual, what is the medication they're taking, from where they're taking it, and how frequent should they take it. By this, you're stopping the black market. You're stopping the uh التخزين, by means every individual
Like
could go
storage,
and
right?
buy. Right. Could go and buy 10 boxes and you will never know if they need it or not. And they could keep it and store it inside their homes and then it got expired or they take it, whatever was the case. And this was also a percentage of the shortage of medications. Individuals, whenever they knew that the medication is getting short, they went and bought by quantities because they were afraid. And you cannot blame individuals to be afraid because the government doesn't have a prior plan, which is plan B, to secure the medications for the individual. So it's kind of a protection plan for them to do, but they didn't thought that an individual could die because of this. Because whenever Lebanon is basically an import country, it's not a local manufactured country. So we only produce, I would say, I don't have exact numbers, but not more than 15% or 20% of the medications, you know? So whenever we don't produce and you only import, and also whatever you produce are based on raw materials imported, then your whole production will stop if you cannot import these raw materials or import these medications. So basically, you cannot supply your country's demand or community's demand by whatever you're importing if you cannot import anymore. Eventually, if you're importing 1,000 boxes and 10 individuals bought 20 boxes, then you have now an unbalanced structure of what will the other individuals do. So by having a medical ID, you will be able to track if this individual bought it from a pharmacy in Bekaa and a pharmacy in Beirut. Everyone will have a shared data system, and we lack proper data. Eventually now, I have 20,000 individuals. I do not know if these individuals are registered in other nonprofits, and I will never know because no one is accepting to share their data because data in Lebanon is treasure and they use it for eventually other purposes. So whenever you don't have a shared data, how will I know if anyone is scamming us or is benefiting more than they should or is not taking more than they should as normal? They could take from me, they could take from 10 nonprofits. No one will know. So and they could also go and buy 10 more. So they now have a supply of 20 boxes And this is leading to not really giving the people in need their rights at the proper time. So we need a lot of reforms, a lot of reforms. But if we have the will, this could be done in not more than a year.
Right.
This whole
Right.
system of implementing it could be done. We implemented inside pharmacies at first, giving the ID inside of hospitals, and we implemented with cancer medications, MS, ADHD, kidney problems. So with the high and severe chronic conditions, and then go less by heart problems, hypertension, diabetes, and so on. But if we have the will, we can. We do not need financials by big financials. It's a one system implementation,
Right.
But we lack willingness, and we lack, I would say, it's not only willingness, because example, if the minister has the will to do it, and the political entourage doesn't allow him, he will not be able to do it. It's a very regulated thing, because of the black market, because also of the borders, unsecured borders, because everyone is benefiting from this
Right. Exactly.
on their own sides. So it's a
It's not
very critical
only it's
topic
not
to
only a
say.
money issue, it's also more than that, I think. It's similar to the
Absolutely.
electricity problem and other problems.
Sure.
Right.
As all.
Right. Right. So Marina, you told me before we started that you are studying biology now.
Yes.
So what do you want to get into pharmacy school or medical school?
Oh, this is a good question. This is my first year in biology school. I graduated from law school last year, and I'm also now sitting for the bar association exam. So I still want to be a lawyer. At the same time, if I am lucky enough to sit for the concours in September, I would have loved to sit for med school and to enter med school, but it's not a question for me. I need time. I need the leverage of time, and I don't have it, unfortunately, now with my donations, my work, and everything on the side. I will go into pharmacy.
Yeah.
So it's a thing that I love it now. I spend my all time doing medical research. I memorized all the molecule names to be able to, contact doctors from South Korea to Greece to France to the US. So I needed this medical knowledge, and I was urged to study the whole curriculum in 3 months to be able to contact all these individuals and, this medical terminology talk. And I couldn't just be on calls with no medical knowledge, and I love it. And also handling all the operations. Now we get medications by blisters, by boxes, from all sources. You need to understand what you're handling. If the pharmacist is not always here, but eventually you need to know what you have. So this was kind of the push for me to enter pharmacy and to enter this world of medications beside law school. But eventually, in the future, I'm gonna merge the two between health and law, and this is what I'm doing right now with the patients advocacy and everything, and health equity.
Yeah. That is great work, Marina. And what's your startup? You told me you have a startup
Yeah,
too.
my startup is social media company. It's called Social Pulse. And also the second startup is the Healing Makers. It's a brand. It's a cloth brand. It's a brand for a cause eventually. Because my donation is not a financial NGO, we created a brand that all the sales from this brand, all the proceeds goes to my donations. So you buy t-shirts, you buy hoodies, sweatshirts with your customized thing, and even from our inspired cards from the journey. And all the proceeds will only cover the cost. All the proceeds goes to the operations, medications, treatments, and surgeries, and so on. And a social pulse is the business side for me, which I have a freelance team inside Lebanon. We have clients inside Lebanon, France, Saudi Arabia, UAE, the US, Romania. So we handle their brands, social media platforms. We do websites, applications, and everything. So this is a hobby side.
You're very busy.
Quite. Well, actually, for good.
I'm glad you gave me time for this podcast.
It's my pleasure. I thought twice, I was in Riyadh when I saw your message, and I was like, okay, I'm gonna make it since it's for Lebanon, and eventually, you never know the connections with Lebanese. I'm always eager to connect more with Lebanese living outside Lebanon, especially I was in the States, and it's heartwarming to see all the individuals still having the flame of motivation and passion to do something. So it's my pleasure, Khalil.
Yeah, thank you very much, Marina, and hopefully we'll hear more about med donations, and you will tell us also how to help. So basically, just send me, or I'll actually look them up too. You can send me your the Instagram page and
Sure,
the website, so we can put them on the
absolutely.
podcast too and share them.
Sure,
And happy to
of
help. We'll
course.
connect offline and see how we can help too.
Absolutely, sure, pleasure.
All
I
right,
just want to
Marina.
end on a note, Khalil, to whoever is listening, Lebanese, non-Lebanese, whoever individual, no matter their age, their gender, their background, no matter everything, if they're in the health industry, yes or not, you can be change makers, lifesavers, and hope creators inside your own communities, countries, and nations, and hopefully in the future, we will be able to say that we were able to change even 1% of this globe. So let's all make it together.
Yep. Thank you, Marina, and I can see how passionate you are about this. Thank you.
Thank you so much.